This is a good position to work on hip rotation, into internal, external rotation. Now, most people that have any hip-related problem are more uncomfortable with the knee up in front of them because it compresses the femur against the front of the pelvis. So a lot of times it's easier to start off with the hip and some extension to work into the rotation, which is less pressure on the groin and the front of the hip. So using a chair, I'll show you facing both directions. If I put my leg on the chair, right, preferably a soft chair, so pillow, this could also be a couch, holding the back of the couch. Now the key here is that I want to try and keep my stomach and my pelvis, my trunk, moving together, so I'm moving at my hip. So if I want to work into some internal rotation, if you look at my belt buckle here, I want to turn everything, but my foot will stay stationary. And this is going to take my left hip into some internal rotation. Trying to make sure that I isolate it to just moving at my hip, not moving way at my back or tilting over or side bending. So you have to be very careful with this one. And you'll see my front foot that's on the ground, I'll almost start to step it a little bit around the corner, especially if I have a chair, so it facilitates my whole pelvis turning to move into some internal rotation. Now this chair has a handrail on it, so if I want to really block my foot, I can put it through this little gap here so it blocks my foot behind me. And I'll turn around to show you, but that'll give me a little bit more something to push against. So if I can get my foot out of here, so you can see from the other side, this is for hip internal rotation. I can put it here, but if I want a little bit more of a block and if I have an armrest, I can try and feather my foot through. And then my front foot is going to start to turn around, and I'm going to move trunk and pelvis together to mobilize this now right hip into internal rotation. Really trying to focus on my trunk and my pelvis moving as one, staying up nice and tall. Now I can do the opposite for external rotation. So for this position here would be fine. And I'm going to be going the opposite direction towards more of a figure four position. So here, I don't have as much to hold on to. So I may want a broomstick or a post for a little bit of balance here. But same thing, I'm just going to be taking my pelvis the opposite direction. So you'll see that foot on the chair or couch, broomstick or post here for balance. And I'm going to start to just turn whole pelvis. And you can see I make this nice four, right? And I'm really trying to make sure that everything turns. So now I'm taking my foot basically towards my opposite thigh, going into hip external rotation. Same thing on this side. Foot against the chair, slowly turning, trying to bring belt buckle around, trying to get this stance leg as far back towards my bent foot as I can to make the four. Obviously, you want to feel tightness. If there's any pain or pinching with this, you're better off backing off short of it and even just doing a little bit of a rocking. So into where you feel it, out to where you don't feel it. Very light motion, really trying to coordinate, like I said, belt buckle, top of your pelvis, and your lower abdomen to move together.